Thank you. So we were able to put a comment, a group authorship comment in the Lancet from the authors collectively of the series. So I'd like to present just a little bit of that to get us started. In the U.S., we talk about summer learning loss, so I don't want you to have lunchtime learning loss and to have forgotten about all the things we said this morning. So I'll be quick, but reiterate a little bit what we had talked about. So again, these are the collective authors for the series. So I think one message is that there has been an increase in political commitment since 2008, that this political commitment is creating some momentum, but this has yet translated into only modest impact. We have yet to see a great inflection of the curve of stunting. It's going down slowly, but we think it should be going down more quickly. So this says that there is still a very large unfinished agenda in regard to undernutrition in the world. The nutritional conditions that we've looked at can be said to be the underlying cause or the cause of 45% of under 5 deaths is a pretty powerful message. That there are still 165 million children who are stunted currently is another very strong message. And that these children who have stunting have compromised cognitive development as well as physical capabilities. And as we've said, this makes yet another generation less productive than they otherwise would be. We do cite in the comment the World Health Assembly targets, essentially saying that these are appropriate targets as they refer to stunting, wasting, low birth weight, anemia, overweight, and exclusive breastfeeding. And although it will be an ambitious task to achieve these targets, and we don't think they can be achieved at the current trends with the current rates of decline or improvement, we do think they are worth trying to achieve, and that with great concerted effort and sufficient support, we think they are achievable, and we certainly should try to achieve them. We've heard about the 10 proven nutrition-specific interventions that could reduce child deaths by 900,000 per year, only in the 34 high-burden countries, and stunting by at least 1/5. In regard to the nutrition-sensitive programs, what we've said is that some, but not all programs in agriculture or social protection with cash transfers or early child development and schooling have shown improvements linked to nutrition and development. But here we need more evidence, and the paper has given some guidance on the types of designs that would possibly have greater effects to reach mothers and children early for longer duration and certainly target the poorest and most undernourished. So these are messages we've reiterated. We again went back to the enabling environment concept and talked about investments being needed not only for the direct interventions, but for the environments that enable them to be successfully implemented or accepted. And this requires a whole set of investments, including building capacity for leadership and institutions to have data, to have information on the problem and monitoring the performance, have accountability mechanisms, to mobilize resources, and clearly to strengthen institutions in the countries with high burden. We make some statements in regard to nutrition being foundational to development. We say we've furthered the evidence base that good nutrition is a fundamental driver of a wide array of development goals. And this, I think, fits within the broader conceptualization of the post-2015 goals. So in addition to having, as I think we're happy about, the healthy growth mentioned specifically as one of the goals by the high-level panel, we also think that nutrition can be well integrated into other goals that they've identified and we think will continue to be discussed and some adopted. We said that countries will not be able to break out of poverty and sustain economic advances if so much of their population fails to get the nutrition needed for a healthy and productive life. And we've quoted some information from Sue Horton, but there are other figures on this, that undernutrition reduces the nation's economic advancement by at least 8% through direct productivity losses, due to poor cognition and reduced schooling. There are some other estimates you may hear, I think, for Africa and and perhaps slightly higher than this, but this is what we put in for a global figure. And we've said, fortunately, the high-level panel listened, even before we published, that the post-2015 development agenda must prioritize addressing all forms of malnutrition, and that should be in the goals. And that the world should ramp up the spending. That we've talked about the $9.6 billion annual investment in these high-burden countries. And we think the increased donor spending is vital if the targets are to be met. In addition to the external assistance, of course, there's a need for national support and more monetary support for nutrition programs, and this needs a budget line and needs additional funds in each of the countries with a high burden. We've said, and it's dealt with in particularly in paper 4, that the scaling up nutrition movement is a critical driver in this effort, and support for it must remain strong. In the individual papers, we have panels on research needs. And we, for this symposium today, decided we would not present all of those research questions, but they're there, and we do think they're important. I would just summarize some of the more general ones here to say that to develop scalable interventions or to improve their effectiveness, especially in the areas where there's still great promise but not yet enough data, preventing fetal growth restriction, preventing stunting, preventing wasting, in fact, as we discussed this morning, preventing micronutrient deficiencies or addressing them in some way, and certainly enhancing breastfeeding practices. These are all areas that need implementation research. We have the evidence in regard to the benefits of these practices or the risk if you are deficient, let's say, but what we need here is more research on the how to best deliver, how to get the most effect, how to have the highest quality programs. In regard to the nutrition-sensitive programs, I think we've had discussion about this, the critical need for more evidence on what works, how to make the very large investments in some cases, for example in agriculture, pay off in the best way for human nutrition. And this will rely on some studies already underway, but of course new studies can be designed to very specifically address what is the evidence on this. And in regard to the enabling environment, we also think there's need for learning and more evaluation and research, not necessarily, probably not randomized controlled trials, but good case studies, good experience learning from the attempts that are going on now to create this enabling environment. And as I said, the papers, I think, have a rich list of research questions. I hope at some later point we'll repackage these so they don't get lost, and we'll actually bring forth a set of research questions for some other symposium or another way to look at this. So to finish, I would say, as the comment says, now is our critical window of opportunity to scale up nutrition. There is international and national momentum to address the human nutrition needs and combine in many ways with food security needs and health needs for this population. So we must, as this emphasizes, work together to seize this opportunity. And thank you all.
Paul, thank you very much indeed. Now what we're going to do, we do have a panel, but I think before we have the panel, why don't we just have a little bit, because we've got all afternoon, why don't we just have a little bit of discussion around Bob's presentation, around a call to action, and that may throw up some questions and issues that we can then take up in the panel discussion. So why don't we start off with the audience?
No, I was just going to make another comment around this call to action. How do you actually move it forward? What have we learned from other sectors that have really, that can make a call to action really? I mean, the last series led to a lot of action. I mean, that paper that called the sector dysfunctional really got us thinking, and the series itself also formed the basis for many organizations' strategies in nutrition. We wouldn't have had that before. Now we have this unique opportunity. What should we be doing differently in the next, couple of months to years to really kind of, further seize the opportunity?
So you're saying we haven't been tough enough. So we should say you're less dysfunctional now than you were 5 years ago.
About the price tag, so 9.6 billion was identified as the price, if you will, of scaling up the 10 interventions that would prevent stunting in 33 million children. And what was interesting, there was two pieces of that. There was the more than half of that number was going to be accounted for from domestic resources from India and Indonesia. And we haven't really talked about India being, obviously the country with the highest number of stunted children, and kind of what to do about that, and thinking sort of about that in terms of making progress. And then the 3 to 4 billion from external donors, and kind of how that syncs up with some of the commitments that we hope to see coming forward on June 8th and beyond.
I would like to go back to this idea of the nutrition-sensitive interventions and make a plea perhaps for when we do look at those sorts of interventions and we look at nutritional outcomes, to also be looking at all the other kinds of effects they might have on health and economic well-being, because I think it's a more powerful argument when you can bring evidence to bear not just on the nutritional outcomes, but on, if you think about water and sanitation, you think about education, there's so many different aspects of those of benefit that might come from those. And I think sometimes we just look at one outcome, and really the sort of economic impact could be placed in a much better light if we could look at all those outcomes together.
Yes.
Venkatesh Manar, Micronutrient Initiative. In terms of our call to action, also to frame it in the context of the fact that most of these high-burden countries are also the countries that will enjoy the greatest demographic dividend over the next 30 to 50 years. That's what we hear in terms of their productive workforces. Is there a way to say that, to maximize the potential of this window of opportunity, we really need to do something about it in nutrition and invest in nutrition?
Yes, Paul Amuna, and I just want to add to the point that has just been made, and that is that if we say we have a window of opportunity, my question is, who are we? And I would like to think that the we are, in fact, the majority of the we are actually out there. And in these high-burden countries, I believe that we're going to need people on the ground who will actually implement or deliver what we want to do. And I don't see them very much in the discussions and in the debates. And I would love to see an opportunity for us to actually engage with the professionals out there in those very environments, so that we can actually dialogue with them in terms of what we are discussing here and what they might want to do about it. Because after all, unless we get them involved, and unless they buy into it, and unless they co-own it, then we are actually making a big mistake.
I just want to pick up on this point, because if I just look outside of the nutrition area, am I supposed to speak into okay, sorry. If you look outside of the nutrition area at the successful initiatives, then there has been a common pattern with them. So if you take Every Woman, Every Child, that required the Secretary General to take that initiative and lead it and become a central part of his strategy as Secretary General. So he has a team which is a little dispersed and quite small, but nevertheless, every year in September at the General Assembly, there's an event for Every Woman, Every Child, and all the political leaders come and they make their commitments, and there's momentum. If you take the Commodities Commission, led by Goodluck Jonathan and Prime Minister Stoltenberg, presented at the General Assembly, a plan is then led by UNICEF and others, Government of Norway, to see that delivered. Commission on Information and Accountability, Stephen Harper and President Kikwete. The common issue with all of these is very high-level political leadership. So my question to us in the nutrition community is, who is our Goodluck Jonathan, our President Kikwete, our Prime Minister Stoltenberg, our Stephen Harper, our Secretary General? Who is going to be the political leader that's going to take this initiative, spend a considerable sum of money setting up a system that can then coordinate others and continue with that through at least one political cycle, ideally longer than one political cycle? If you look at Gavi, it started off with Government of Norway investing with the Gates Foundation in Gavi, and then those two institutions over the last decade or so being immensely committed to scaling up access to vaccines. So who's going to do that for nutrition? Is it going to be a Gates Foundation plus X initiative? That's what we need. That's what we really need for this. And we need to be thinking who's going to be that person. Zulfi.
So I very strongly concur with the last sentiment, but I'd like to take it a step beyond. So yes, we do need champions. We need global champions or people who cover more than one geography, regional influences. But the bottom line, Richard, is country-level engagement in terms of sustaining this requires buy-in at a country level, not just from the politicians, but from civic society in general. So I think our real challenge now is to take it out of the pages of the Lancet and informed intellectual debates to where there is really public buy-in of these kind of initiatives, which have happened around several issues. So linking this to a human rights agenda, linking this to a development agenda, linking this to a women's empowerment agenda, these are critically important. And from that may emanate the political will to see this across, as you said, political life cycles. I mean, this is not something that can be done in 4 or 5 years. My final point on that is to you, is the accountability element. I mean, there are indicators within the accountability commission's work and the IERG on nutrition indicators. Yet holding people's feet to the fire and making them accountable for those indicators would ensure that these nutrition-specific and sensitive interventions are implemented. Are we prepared to make nutrition much more central to the accountability framework?
Any other? Yes, please. And then I think we'll go to the two comments over here, and then I think we'll go to the panel. Give Bob a chance for some.
Catherine Hagan with the Global Social Observatory. Several of these comments have been very useful in terms of thinking about the local role that needs to be mobilized to support all of this. And we've done a lot of work looking at the Global Fund and the issue of how HIV/AIDS was effectively mobilized. And one of the points that really came out there is that people affected by HIV/AIDS were directly involved in mobilizing the support. It's not only the professionals who are delivering the services, but it is the people themselves who are suffering. And there should be some way that we can think of to support the kind of civil society networks that are oriented to not just delivering services to the poor, but representing and bringing up the issues of the poor themselves who are trying to overcome these issues of undernutrition.
Sabrina from Results UK. My question and concern is obviously from the 2008 series, you've gone from a coverage or a scale up from 99% to 90%. And obviously I understand it has to be more achievable, measurable target. But my concern is that we're just going to go then for the easiest to reach, the easiest to have an impact on, and that last 10% could mean that we're not reaching the children that are most effective and most in need of interventions.
Okay, well, why don't we let Bob have the final word and pick up a couple of points raised there, and then we'll come to the panel.
I don't want to take much time because the panel discussion will be interesting. I would just say I agree with all of the comments. That's my first response. I mean, I think you've all made very cogent points, and certainly the national ownership is the critical part, the national engagement, civic society. You know, to Lucy's point, we made, with the costing, a huge assumption that India is going to pay for their own services and really prioritize that. I don't see that happening. Right now, I don't see the commitment in India for that to happen. You know, that's something that they need to work on and see if they'll make that commitment. And you know, the multiple outcomes, I think, is also very important. You know, we tend to carve up things so they fit in the page limits of the Lancet, and also, of course, to provide focus and sort of cogent messages. But you know, we've already talked about the multiple outcomes, developmental and national economic outcomes, but many of these interventions we're talking about, particularly the nutrition sensitive area, has other outcomes beyond nutrition that we ought to be looking at as well, and framing all of those, I think, will help the argument immensely. So I'm looking forward to the panel, so I don't want to take any more. Okay. Thank you for your time.
Thank you very much indeed, Bob. Big round of applause.